So we're going to do oral thoracic dissection. We're starting with the bone snips, and I'm just putting this in one corner of his mouth. And then we're going to open the oral cavity by breaking part of the mandible. So you should hear it crunch when you do this. And then we do the other side. And this mink's mouth is open quite a bit, but even if the mink's mouth is not open this much, you can still get one end of the bone snips in there. So you know you're doing it right if you hear that crunching sound. Now once you've heard a couple crunches, you can get scissors to open it the rest of the way, because now all you should be cutting is muscle. So I'll cut down and see how far that opens. So let me go to the other side. You gotta watch their teeth and any broken edges of the bone because it is sharp. So now, if I pull this down, you know that you've gone far enough if you can get to the back of his tongue and find this epiglottis, which is this little yellow looking flap. And then that opening is the glottis. And then this opening is the opening to the nasopharynx. And then this part is a soft palate, and it actually has a soft texture to it. This would be the hard palate. And then between the hard palate and the soft palate on either side, there's some holes. And these are the internal nares. There we go. And they're not as distinctive as something like the opening to the nasopharynx, but you can feel them with your probe on either side of that soft palate, right before it transitions to the hard palate. Here's the tongue. So that's how you get into the oral cavity. One thing to notice, the mandibular salivary glands are these oval glands, okay? So there should be one on either side. And then most of the minks have a hole here to start with. So we're going to use that hole as our starting point for getting into our thoracic cavity. So right there you can see a thyroid gland just sticking out. Usually you have to dig for those, but it's right there. So then you can start by cutting this muscle on the outside of the thoracic wall, and about the time you get to his arms or forelimbs, you're going to run into the rib cage. So here you can see how thin that muscle is, okay? But once I get down here to my rib cage, it's going to get a little bit harder to cut because we have to go through the sternum. So when you're pulling up on the thoracic wall, you see vessels like this stuck to it. You want to cut those free so that they stay down even though we're pulling up on our thoracic wall. And then I like to put the scissors in kind of flat and see if I can get up under that rib cage. And you should be able to feel it and lift the whole mink up. And then we know how deep we have to cut. And the scissors can cut through the rib cage. I like to go slightly off center so I'm not going right through the sternum. So we're going to cut down. And you'll be able to tell that it has slightly more resistance when we're cutting through those ribs. And then you don't have to go all the way down. We're only going to the bottom of the rib cage, and usually you can feel that. If you go too far, it's okay. But once you get past that rib cage, you're going to do these lateral cuts out to either side so that we can open up this thoracic wall like a jacket, okay, like a button up. So now, if I look inside there, I can see the places where my ribs were. And right up here at the top, where the very top ribs are, I usually cut those separate because the way they're curled, it makes them extra strong right there at the top of that rib cage. There we go. Okay. So now I gently pull apart the rib cage, and everything at the top wants to stay in place. So this is where you can take your scissors and gently separate it. You might have to break that rib so it lets go and it's able to fold outwards. And then see my lateral cut on this side needs some help, so I'm just going to tear this. And when I'm tearing this, I'm separating it from the diaphragm. So let's see if I can cut these more. It drives me crazy when they fold back into place. Break these ribs. There we go. So this sheet of muscle is the diaphragm underneath the lungs. And then this connective tissue is the falciform ligament that attaches the anterior abdominal wall to the front of the liver, which is right here. So here's my diaphragm, there's the liver. Up here would be the lungs. So in minks, we've got a cranial lobe, and then we've got a middle lobe, and then we've got our caudal lobe, and then there's an accessory lobe. And in order to see the accessory lobe, you have to go under the apex of the heart and kind of pull up on it. And then look under there and you'll see your accessory lobe. You can also see the inferior vena cava right there. And then between the cranial lobe on the right and the cranial lobe on the left, there's the thymus. So we can remove the thymus, and we have to remove the thymus in order to get to the vessels like the aorta and the subclavian arteries that are coming out of the top of the heart. Now this big blue guy, you should know that is the cranial vena cava, also known as the superior vena cava. The trachea runs right behind it. And then if we kind of dig around at the top of our left atrium, we're going to feel the aortic arch. Oftentimes you won't see the aortic arch, but you can feel it. And what you'll see is your brachiocephalic artery and your subclavian, your left subclavian artery coming out. And so I usually scrape the direction that they would go, and that makes it easy to find them. So this would be my brachiocephalic artery. And then down here, I should have my left subclavian artery. There's some little fibers from the vagus nerve, but there it is, okay? So my left subclavian artery is going to go up to the left, whereas my brachiocephalic artery is going to kind of go straight up underneath the superior vena cava, or the cranial vena cava, up here to separate into my two common carotid arteries, which are on either side of the trachea. Now, the latex burst a little bit, but on either side of the trachea, there's a bundle that includes our common carotid arteries and also the vagus nerve, cranial nerve number 10. And then also in there is the internal jugular. So you got three things on either side of the trachea. Okay, so it's a little bit hard to see the blue on our internal jugular vein, but it's in there, bundled up with the common carotid. Now, right here where my cranial vena cava came up, there's a lot of things going on, and I'm going to have to use my scissors to separate this a little bit more. Usually when we're dissecting our minks, this is the part that gets really tricky, because veins are tricky. They're very delicate. They don't stay put. So up at the top here, we've already identified our internal jugulars. Okay, so you should have one on either side. This is an external jugular vein, so he's a big guy, and there's the other external jugular vein. And then you've got subclavian veins. You've got one going off to the left, and you can kind of see that one. I tore my right subclavian vein, so that one's not as visible. So you should have subclavian veins, external jugular veins, internal jugular veins on either side of the trachea. If we go all the way up to the top of the trachea, you should find the larynx. So these C-rings that kind of give it that rigid look are going to stop at the larynx, and you'll be able to feel the thyroid cartilage of his larynx right there. And then on either side would be your thyroid gland. So we found this thyroid gland already. And then if you dig around in this connective tissue, you can find the other one. So they're kind of like oval shaped. Okay. The azygos vein is best seen if you pull all the lungs over to the side. look behind them, and it just looks like a bunch of fat, right? Connective tissue. But if you scrape it, you should see the azygos appear. There it is. It's often mistaken for the inferior vena cava, but it's not. It's coming up to the top of the heart, whereas the inferior vena cava was sort of nestled between the lungs right there, and it's way bigger. And then to find your aorta, I always like to go from this side. We do something similar. We pull all of our lungs over to the side, and then look up under them. And then, since we're putting tension on the heart when we do this, that's also going to put tension on the aorta. And then we can scrape around in there till we find it. Now that's the esophagus there, that's not the aorta. Where is that thing? There's the trachea. So there's the aorta. It's not very pink, but that's the aorta right there. So when you pull on the heart, you should feel the aorta pulling also. Right? So that's it.